Hypertension, or high blood pressure, affects millions worldwide and is often called the silent killer. Hypertension is a chronic medical condition where the force of blood against artery walls is consistently too high. There are two major types: primary or essential hypertension, which accounts for up to 95% of cases, with no clear cause, and secondary hypertension, which results from conditions such as kidney disease, endocrine disorders, or certain medications. The first and most common type is primary, or essential hypertension. It accounts for about 90 to 95% of all cases. There is no single clear cause, but it develops gradually over many years. It results from a combination of genetic predisposition and lifestyle factors. These include obesity, a high-salt diet, lack of physical activity, stress, smoking, and aging. Because the cause is not specific, treatment focuses on lifestyle modifications and long-term medical therapy. The second type is secondary hypertension, making up about 5 to 10% of cases. Unlike primary hypertension, the cause is identifiable. It is usually the result of another medical condition or drug effect. Examples include kidney disease such as renal artery stenosis, hormonal disorders like hyperthyroidism or Cushing's syndrome, certain medications, including oral contraceptives, steroids, or NSAIDs. Secondary hypertension can appear suddenly and often at a younger age than primary hypertension. When the underlying cause is treated, blood pressure may return to normal. Several factors increase the risk of developing hypertension: advancing age, obesity, family history, high salt intake, lack of exercise, smoking, and excessive alcohol consumption. Most people with hypertension have no symptoms, which is why it is often called the silent killer. Occasionally, patients may report headaches, dizziness, chest discomfort, or blurred vision. If untreated, hypertension can damage vital organs. It increases the risk of stroke, heart attack, heart failure, chronic kidney disease, and hypertensive retinopathy affecting the eyes. Diagnosis of hypertension must be accurate, because blood pressure can vary throughout the day. A diagnosis is confirmed when blood pressure is consistently equal to or greater than 140/90 mm of mercury on at least 2 separate occasions. Ambulatory or home blood pressure monitoring is often recommended to rule out white coat hypertension, where readings are only high at the doctor's office. Other tests are done to look for possible causes or complications, including blood tests, urine tests, and ECG or echocardiogram to assess the heart. The first step in treating hypertension is lifestyle modification. This includes reducing salt intake, losing weight, regular exercise, quitting smoking, limiting alcohol, and managing stress. These changes alone can significantly reduce blood pressure, and in some patients, they may be enough without medication. When lifestyle changes are not enough, medications are used. The main classes of antihypertensive drugs include diuretics, which help the body remove excess salt and water; ACE inhibitors and ARBs, which relax blood vessels by blocking certain hormones; calcium channel blockers, which relax the muscles of the blood vessels; beta blockers, which slow the heart rate and reduce its workload. The choice of drug depends on the patient's age, other medical conditions, and possible side effects. Most patients eventually need more than one medication for effective control. Successful treatment of hypertension requires long-term follow-up. Patients should monitor their blood pressure regularly, adhere to medications, and continue lifestyle modifications. Prevention is always better than cure. A quick summary about hypertension. High blood pressure, or hypertension, is often called the silent killer, because most people don't feel any symptoms while the damage quietly builds up. Hypertension means the blood pressure in your arteries stays higher than normal, usually above 140/90, or in some guidelines above 130/80 mm of mercury. There are two main types. The most common is primary hypertension, which has no single clear cause, and secondary hypertension, which results from conditions like kidney disease, hormone problems, or certain medications. Several factors raise the risk, such as older age, obesity, eating too much salt, smoking, stress, diabetes, a sedentary lifestyle, and family history. If left uncontrolled, high blood pressure can cause serious complications. It increases the risk of heart attacks and heart failure, strokes, kidney damage, and even eye disease that threatens vision. The good news is, hypertension can be managed and controlled. The first line of defense is lifestyle changes. Eating healthier with less salt, exercising regularly, keeping a healthy weight, quitting smoking, and limiting alcohol. If lifestyle alone isn't enough, doctors prescribe medications like diuretics, ACE inhibitors, ARBs, calcium channel blockers, or beta blockers, depending on the patient's needs. Hypertension may be silent, but it's not unstoppable. With regular checkups, healthy habits, and the right treatment, you can protect your heart, your brain, and your life.